Hi, I'm Dr. Elizabeth Coyne, and I'm going to present A2 for managing complex clients. So make sure you just have a look at the learning objectives to make sure you're aware of what you're meant to be presenting to us, because assignments about you demonstrating your understanding and ability to meet learning objectives. So assessment item 2 looks at the presentation of a complex client where you've managed and you've assessed them for that risk of deterioration, and how you've then looked at a plan to improve situational awareness during transition. So it's quite a complex where you're presenting a patient who's at risk of deterioration. You're detailing the issues and the concerns in the assessment model for detecting that, but you're also looking at the situational factors, not describing them, but critiquing them with evidence. And you're designing a nursing management plan where you're actually looking at what the risk factors are, how to reduce them, how to make sure you can follow on with assessment. Making sure that this is quite well evidenced and then presenting a conclusion at the end. So your introduction and summary, we're 45 marks. So make sure this has got enough points in it. So we've got some word count for you there. So present your summary, making sure you're going through the issues. It's 300 words, but then remembering that you're actually, we're going to mark this for 45 marks. So make sure you've got a nice complex client. And it can be in relation to your clinical area. But if you're working in aged care or maybe a medical ward, think about the complexity, maybe transitional periods, admission periods, so that this is then adds to your complexity. Make sure in the situational awareness aspect, this is where you're presenting your critique, we're 40 marks, that you really are critiquing and with evidence. And your management plan, again, with evidence and a clearly worded conclusion to go through the relevant points that you presented previously. Make sure your use of literature is strong. And so, really looking at evidence which supports your particular patient cohort, the risk of deterioration and the assessment of that. And make sure you're actually sort of really looking at a comprehensive management plan. This is where 40 marks. References. So just remember, review what APA looks like. Word count is exact. And really think about spelling. Make sure it is Australian, not American. And really look at the flow. So it should be, you should be able to look at each paragraph and go, that leads to the next one, which leads to the next one, which is clearly then in my conclusion. Thank you.